Are we good to go? Everyone can see it? I'm unable to see everybody's response, so.
Yes, we are ready.
Thanks, Vanessa. Hi, everybody. I'm Cheryl Van Brakel, and thanks so much for being here with us this evening. I am the Director of Health Promotion and Community Advocacy at People's Community Clinic, and I am joined by Nancy Sanchez.
Hi, Nancy Sanchez. I'm a community health worker at People's Community Clinic.
And this evening, we're here to talk to you about some of our efforts around civic engagement in a clinical setting, with the hopes that not only just to share some of the things that we've done, but with the hopes that you're able to take some of these ideas and implement them in your setting.
Hi, everyone. We'll start with our mission because it's who People's is. The mission of People's Community Clinic is to improve the health of medically underserved and uninsured Central Texans by providing high quality, affordable healthcare with dignity and respect. So treating patients with dignity and respect begins with asking questions about our patients' priorities and working on those upstream issues with our patients.
Awesome. Yeah, so Nancy and I work in the Department of Health Promotion and Community Advocacy, which is a department that's made up of health education team, a nutrition team, a lactation team, and a community advocacy team. And that team is composed of community health workers and a social needs coordinator. And the department functions under a model called the Spectrum of Prevention, which is a model created by Prevention Institute, which is like a think tank out of California. And they create models that kind of help you work on a lot of prevention efforts. So the Spectrum of Prevention is a model that actually has 6 levels in which you can prevent injury or illness. And those are strengthening individual knowledge and skills, so enhancing an individual's capability to prevent injury or illness, promoting community education, so reaching groups of people with resources to promote health and safety, educating providers, so anyone who transmits skills or knowledge to others, lots of our partners that we work with, or just interdisciplinary education for each other, fostering coalitions and networks, so just convening groups and being a part of some of those larger efforts outside of the clinic in order to create a larger impact. Changing organizational practices, so just different things, different norms that we can create within our clinical setting that are different in order to see optimal health outcomes. And then last but not least, influencing policy and legislation. So developing strategies to change law and policies to influence outcomes. And under this level of the spectrum of prevention is where our civic engagement efforts sit within our work. Oh, you're muted, Nancy.
Thank you. I'll start off with staff engagement. It's a critical part or critical step in increasing patient and community involvement in the civic process. These efforts helped us identify leaders within the clinic. So as you see in our pictures, you can see that we had a volunteer deputy registrar training at our clinic. This was simply an invite to our staff to see who was interested in becoming a VDR, but it also increased the access or an opportunity to increase voter registration for our staff. Something else we did was we regularly communicated with non-partition information, such as voter registration, poll locations, waiting times. We made that available for staff to have easy access to. We conducted a baseline survey to gain an understanding of staff's level of civic engagement. We did this through tabling at the clinic and just asking staff, and then we also did it at our all staff meetings where all of our staff is together. We provided surveys so that they could fill out while we did our trainings and things like that. We included staff in community organization activities such as organizer training, house staff meetings. So we had meetings where house meetings with staff only, but then we also had community house meetings as well. And that staff was able to participate and facilitate or lead. We also have had community block walks where we provided information about voter registration and through the clinic, the clinic or the community that's close to the clinic. And then we also had hosted non-partisan education sessions on ballot and voting. One of the education sessions was done by League of Women Voters. And we had a lot of great turnout for that. I think staff really enjoyed that and got a lot of useful information.
And so on a separate note, patient engagement is obviously critical. This increases the opportunities for civic engagement and allow for conversations and a deeper understanding of the connection between health and policy. Some of the ways that we have worked to increase, in particular, patient engagement is one of the things that we did is added voter registration question on our social determinants of health screening. With having staff trained as VDRs on site, that gave us the ability to be able to register patients on site when those questions came up. And so we wanted to have intentional way to be able to ask. We also include voter registration forms in our adolescent to adult transition packets. And we also are, able to have folks come in and table like JOLT and League of Women Voters to be able to register our patients as well. And one of the things that we suggest, and we are still working on, is for if you're a patient, like if a patient process or an intake process happens where there's an initial visit, working with, like, for us at the clinical setting is a financial counselor. And training those staff as VDRs to add a voter registration component to that visit. We also worked to use our platform that we have now to text and communicate with patients to send some general information about voting, similar to the information that we share with our staff, as well as invitations to some events that we have, which Nancy will talk about.
So pre-COVID, right, we were able to join, we were able to go to health fairs and table at different events. And we were able to provide voter registration information. As you can see on the bottom, we have a photo of some interns and Anne-Marie at a table and event at ACC. So we were able to do events like that and provide information to people that went to those events. We also participated in National Voter Registration Day. And you can see we did for this past voter registration day, National Voter Registration Day, we did a drive-through at our clinic. Cheryl talked a little bit about sending out text message to our patients to be able to provide that information. So we were able to register, I think, at least 14 people that day. It doesn't sound like a huge number, but it was really big to us because it was our first drive-through that we had. And we were able to take advantage of our drive-through that we had for testing and use it for to register patients and community members that were coming through the clinic, well, mainly patients, because that's who we were able to send text messages to. But that was a really great opportunity for us to be able to do something during COVID. And then we also had coordinated with non-partisan community-based organizations. Like Cheryl said, we had League of Women Voters and JOLT come out, and they were able to also table at our clinic and provide information while there about voter registration and voting in general. Thank you.
Before I talk a little bit about some of our next steps, like for a large portion of our patients are undocumented and or ineligible to vote. And we do the volunteer deputy registrars that we have at the clinic as well as the volunteer deputy registrars that work for PCC. We do have conversations about alternative efforts that those individuals can put. So we talk about giving someone a ride, or just transmitting information to those around about the importance of voting and kind of what's on the ballot. And so there are staff that when we began these efforts who were wanted to be involved and wanted to help, but were not eligible to vote. And so they helped us think through ways that we can also include our entire patient population in these civic engagement efforts. And so some of our next steps, because we want to give some time for questions, but some of our next steps are we are working with Dell Med School, Call for Ideas, to finalize a one-pager with the efforts that we did that we can share with folks and hopefully you guys on here. We plan to continue our and increase our efforts both in the clinic now that we're beginning to be back on site, as well as virtually. We had our first virtual community organizing training and have practiced doing our house meetings in a virtual setting. So our goal is to get those back up and running again. And then this year, we hope to create a policy agenda based off of our organizing efforts, our social determinants of health screening, as well as input from community and patients, as well as our medical legal partnership team. So wanted to take a little bit of time for questions. If you'd like to put it in the chat, you can, or if you want to unmute yourself, I think there might be some in the chat already. But yeah, are there any questions? I'm unable to see if there's anything in the chat.
Yeah, I'm monitoring the chat. This
Okay.
is Vanessa, and it says you all do great work. That's what Nicole said, but I haven't gotten a question yet.
Hey, this is Anne Marie. I was just curious to hear if it's okay, Nicole and Brittany, if you're in this session. So one thing that was really cool is that in addition to all the amazing work that Cheryl and Nancy were doing within the clinic and on site and within our community, at the same time, our youth advisory council members were also invited to participate with a youth voter engagement project. And that was really exciting because they got to be engaged as some of them were not yet old enough to vote and yet still were really engaged. And then we were able to share some of their efforts and some of the information that those youth created along with other youth in Central Texas on our social media to help get the word out.
So I have a question here, and I wasn't sure if you had any, Nancy or Cheryl, if you wanted to respond to Anne Marie's comment. Okay, all right.
They don't need to.
Okay, I wasn't sure if they wanted to add anything. All right, so Clara asked, would you be able to discuss your transition planning packets and what all is included? Her program also provides packets, but they never thought to include voter information.
Yeah, and Anne Marie's online too, and she's actually been someone that's helped us with that. If she wants to give any information on that as well.
Sure, happy to. I know I felt like I'd already talked enough, but yeah, so our Youth Advisory Council, I guess a year or two ago, helped give a lot of input on some informational packets that our clinic gives to people, our patients, right before they turn 18. And it was a real collaborative effort between our youth and then also the medical legal partnership, providers and others at Peoples, because what our providers were telling us is that when teens were turning 18, suddenly that meant they were now responsible for their own health care. And suddenly, the clinic was not able to share information with their parents as freely as they had done when they were younger than 18, when they were a minor. And so, well, for some patients, they were fine with that. But then we also had a lot of patients for whom that was really jarring. At the same time, we also had patients who maybe still needed or still wanted a parent or other guardian to be involved in their medical care and decision making. So we put information about different options for guardianship and medical decision making in the packet. We also gave a reminder of all the services that are available to young adults at our clinic. And then we also started putting voter registration cards and information in those packets.
This is Claire. That sounds very similar to ours. We just hadn't occurred to me or any of us, the voter portion. That's really neat. So.
Yes, and Anne-Marie, I think you're talking about the little Travis County cards, right? Is that what you mentioned? Because there's usually a voter registration. It's probably, I'm sure it's that. It's a voter registration form, and then there's I'm blanking on the name right now. If Cheryl's on, she might remember. The little cards that we have, the Travis County.
It's votetravis.com. So the Travis, we work really closely with Bruce Elfont's team and voter registration. And so they are able to provide us with a lot of materials that we can put up in the clinic, as well as things that we can hand out. And I also wanted to say, plug that Jolt they have amazing resources that are geared towards youth. So, I think, they can provide things that can go in as well.
Yeah, and I think creating that relationship with those organizations made this work a lot easier, I feel, because we had, we could reach out to people if we had questions or if we needed something in particular, like League of Women Voter Guide or anything like that. It was a little bit easier, I feel, to gather that information.
Hi, it's great to see y'all, and thank you for the presentation. I definitely think that getting 14 people registered to vote is a huge win, so congratulations on that. And I feel like I swear there's a question coming. I feel like with the rapid adapting that we keep doing in the clinical setting, I'm curious to know if you would, one, consider holding a drive-through voter registration again, and two, if you did, what you might have learned from the first time to adapt, whether it be for another drive-through clinic or for just voter registration in general.
So we are actually planning since we are going, like Cheryl said, we are planning on returning to the clinic or have more of a presence at the clinic than we have in the past year. So we are planning on being present on at least one day for that drive-through. I'm not sure the logistics yet, and Cheryl, if you want to give some more insight on that, but we are planning to have that, and that may be a little bit more geared to our patients than the whole community, but it's definitely something that we're thinking and in the process of.
Yeah, I think that we have lots of eager staff who want to work the drive-through clinics or the drive-through vaccine. I can't even talk today, guys. There's lots of drive-throughs, drive-through voter registration. And so we had a lot of staff there. I think we just maybe need to think through, and it was pretty quick turnaround to get the approval to use the drive-through from the time that in the event. But I think now that we saw that it worked well on days that we weren't using that for vaccines or testing, that it's something that that is definitely doable, but I think we want to, a lesson learned would be maybe a little bit more outreach and a little bit more time to prepare and kind of let that event be known.
Yeah. Yeah. And
We have an
possibly do a
additional,
little bit more
go ahead,
outreach
Nancy.
to the community so that we have community members also coming to register instead of just our staff or our patients.
Wouldn't it be great? Hi, this is Selena. I often help with the voter registration stuff at the clinic, and I was very happy to help with the drive-through. That was really fun. But wouldn't it be great if we had like one side you get your voter registration card and then the other side you get your COVID vaccine? It's like a 2-for-1 deal, right? And starting Monday, all adults can register for the vaccines. So I feel like if you're an adult who can get a vaccine, you're also an adult who can sign up for voting. It's going to be like the easiest way to like plug the two, I think. Just a thought, just a random idea that crossed through my mind.
Preview for next year's presentation.
Yeah.
We have an additional question. So when you hand out the transition packets, do you go over the material with the young adults?
I can respond to that. Yes.
I was just going to ask you.
Yeah. Yeah. So they get that packet when they check in for their appointment at the front desk. And so the patient service representative hands them the packet, explains briefly what it is. And then they tell them, while you're waiting for your appointment, go ahead and look through it. And then if you have questions, you can ask your provider when you go back for your visit. And then our providers will also frequently talk to teens when they see that they're getting closer to their 18th birthday to see what questions they have as they're getting older.
And having trained VDRs is really, really amazing to have at the clinic, because once that conversation starts, the provider can then ask them, are you interested in registering? And they can contact one of the staff members that is a VDR and they can register them right away at that time.
Okay, we have 9 more minutes left in this session. Any more questions? Don't have questions, you can always move to networking. So what we'll do is, I'm going to wait 30 more seconds to see if there's any more questions.
I had a question about,
okay.
You were very pleased to have, I think, 13 people who registered to vote, which is wonderful. I'm just wondering what proportion was it to how many of the whole population that you were approaching?
Oh, I think Nancy, you are on mute.
Sorry, I didn't hear the question very well.
So you said you had registered 13 young people, which is great, but what was the proportion to the whole number?
Oh, so this, the 14 was from based on just our drive-through. So that was just on one day that we had our drive-through registration.
What was the percentage of people that you got to register?
Percentage from?
I don't know if
we're getting, ready for their transition.
Oh, she means teenagers, right? Like the teenagers that get the packets.
Right.
Do you have any idea?
You get half of them to register, or 10%, or what was the proportion? I'm just curious.
I am not sure if that's known, honestly. Cheryl or Anne-Marie, if there's any.
Oh, okay.
You stumped them.
I'm not sure we've gone that into depth on any of the data or anything like that we've been able to put together.
I'm about to like offer up something, and I know that I'm just gonna volunteering myself to do some of this work because I'm coming up with this idea now. But I think it would be really great for us, for us at the clinic to share this out with like other agencies. And I know that's the plan anyways with our like one pager, but I was thinking like, it'd be really cool if there's agencies here who work with adolescents to kind of allow us to do maybe a focus group with those adolescents, with those teens, to better understand what motivates them and what's important to them. Because it was interesting earlier when I was in the session with the girls, well, they're adolescents, young adults. They were doing the health education presentation. And, one of them was saying like, I really wish that things would have been taught, sex education would have been taught in my classroom. And, you don't think of it sort of as something that you can vote on, but it is, right? Like who decides our curriculum in school is very much determined by who we vote into office locally, in your county, in your state. And so I think if that's something that's really important to adolescents and young adults to work on or to understand or to have better access, and that's something that voting can be a good connection to. And so I think it'd be really cool for us to be able to share this out in more than just, here's our one pager, but like, let's hear what motivates you and let's make that connection and bridge that information of what you care about and why it's important to vote.
Yeah, definitely. I mean, that is super important. And if there are any other organizations on here, please reach out to us because we'd love to work with y'all. So.
I want to say that's a really good point. This is Vanessa Sadia from Cardia. I was just thinking about my daughters, and how they've gotten very engaged, given what's been happening in the national scene. And even though I've worked for elected officials locally, they are not very aware of them, and they don't really connect the policy at the local level or at the state level with how their lives are impacted. Like in school, for example, what curricula is taught and so on. So I think that's a really good point to emphasize how important local and state elections are too.
And one of the things that we have done, we actually, the Youth Advisory Council has participated in block walks with us and talked about policy agendas and worked. We invite our Youth Advisory Council. We're in the process of creating another Youth Advisory Council for our Maynard Clinic, but we do invite them to participate in our organizing efforts with Central Texas Interfaith. So there is that ability for them to learn a lot more about what they're voting on locally.
And if I may just intervene just quickly. Hi, everybody. This is Brian Naya, one of the Youth Advisory Council members.
Will you speak up, Brian? I can barely hear you.
I'm sorry. Can y'all hear me now?
Yes.
I've been quietly listening into the back, and I wanted to just thank y'all so much. I definitely agree with what y'all are saying. I'm halfway in agreements with Vanessa, just a little bit, because I did run a campaign recently, and I am a young adult. I'm within the age range that y'all are representing. And I took it upon myself to educate myself on policies pertaining to, mental health, reproductive health, higher ed, and I'm a Maynard resident. Yes, for those who have put it in the chat. So I would love to be able to help in any way I can, especially given youth perspective on some of the things that may be going on. One of the things that I've realized and have seen is that I want to say adults don't recognize the fact that we as young adults are very vigilant within and about our surroundings. I grew up in a sense where children are seen, not heard. So some of us who probably grew up within my era too are probably holding their tongue, but we're not blind to the fact of what is currently happening around us. We have a voice, and we are always looking for avenues in which to express and definitely give our input, especially pertaining to policies that would directly impact us, whether it be local, state, or federal. But again, as we are as time goes by, we're only seen and defined by our age rather than our maturity level, in which we can not only comprehend but also acknowledge what is being said around. And thank you for those who have voted for me.
Thank you, Brian. Yeah, I wanted to follow up on that. Thank you for, I appreciate you saying that, because I do think, as Cheryl was saying, that even showing examples of policy agendas and how they are tied to like local or state elections, so that just, we need to educate. Brian, you made the effort to educate yourself about those local and state agendas, for example, and national agendas. But I think more is needed to tie what's happening in our community to what level of policy to help further educate. Thank you.
Yes,
Well, I think
and the biggest thing about that is language. Definitely work with language, because you have, we're so diverse in how we speak, but there is a common language that we all understand, and it's on that frequency in which we need to, one, be able to um isolate, and two, be able to tap in, so we can all, be are able to not only communicate but comprehend each other, because there's a lot of terminology that I had to go back and look up in books, ask around, navigate, but it all came out to mean the exact same thing in just a bigger wording.
Thank you.
I um I want to, Brian, I want to acknowledge your passion, because I think that's really important. Whenever we're looking, well, when we're thinking about policies too, because whenever we're interested in something, we tend to be more passionate about it. We tend to dig deeper into it and learn more about it. So I think that if we can find what our adolescents are passionate about it and connecting it, like Selena said, to policies, then we have a greater chance of our adolescents in our clinic, in our community, to really, speak up and bring their voice up. Not that they don't have a voice, but sometimes it could be intimidating. But like I said, if we can find that passion and what they're interested in and what matters to them, then we can definitely connect that to something in policy that they can be passionate about and work on and learn about and want to make movements in.
And keep in
And
mind, these young adults are tomorrow's not only leaders but physicians as well, that will be firsthand in not only facing the implemented policies of the future, but also offering direct care to future adolescents as well. So we want to definitely bring them the right resources along with the right guidance to matriculate them into whatever position they see in life. And with that, 2033, look for me, Texas governor. That's all I'm gonna say about that.
Yeah. Thank you for sharing.
yes, thanks so much, Brian. I'm pretty sure Anne Marie has bugged you already for me. um, yes, and I think that is definitely something that we learned. Matt Flores from Travis County Voter Registration Department always talks about, and if anyone has ever done a VDR training with him, he always talks about, how you connect to the people that you're trying to get to register to vote and finding what they're passionate about. So yeah, that's very important. I'm really excited about this conversation and everyone here. So thanks, everybody.
So we are at the end of the session. It's 7:32. We're supposed to end at 7:30, and we're going to transition into a networking break. So I think at this point we stop recording. But before we do so, I just wanted everybody to know that at 7:40, which is 8 minutes away, we'll have session 5, Engaging Youth and Families of Color, with Brittany Cavell and Nicole Trevino. And then also at the same time at 7:40 to 8:20, Maintaining Physical and Mental Health During a Pandemic, with Dr. Neville and Eliza Peach, is it? And Brian, you're going to be on the next panel. So thank you. So I don't know who's Somebody, yes, I think somebody's going to control the recording piece here.